So has anyone here ever broken any bones?
Yeah.
Then you know it's not a fun process of recovery, right? So I've broken many bones over the years playing multiple sports, and I know that process isn't fun, but from that I gained a little bit more. I gained an interest in medicine and orthopedics specifically. Hi, my name is Bryson Strachan, and my topic for ISM is orthopedics. So part of the reason I took it is because I wanted to figure out what exactly I want to do in the future. I wasn't sure if I was interested in medicine or what. And this quote I chose helps represent that. Its definiteness of purpose is the starting point of all achievement. And it's basically, through this class, I'm just trying to figure out what really I want to do in the future. So it goes off that quote. So this is a little bit about me. I'm a senior at Frisco High School. I played football on the football team all 4 years and ran track for 1 year. I will be attending the University of Texas next fall, and I will be majoring in economics. So the reason I'm majoring in economics is because it's a good general major. It might seem weird because my topic's orthopedics and has nothing to do with each other, but it's just a good general major for me to figure out what I really want to do in the future. And why ISM? So as I explained before, I kind of just use this class as good real world experience, and on top of that, it helped me figure out if it's really something I want to do. So throughout the year we did a lot of research, and this is just some of the few that we did throughout the year. So the first research assessment I did was a career outlook assessment, and this is just basically an overview of being a physician. And the median pay is around for 2012 is around $396,000, which is a very high number, as you can see. And but you have to have a doctoral professional degree to become one, which basically shows you have to go through a lot to become one. You have to go through many years of education, even after undergraduate. But the job growth is at 18%, which is extremely high, and it works specifically with musculoskeletal system as orthopedics. Next one I did was specializations of orthopedics. So one of the first was orthopedic oncology, and that's the top left picture. And oncology is it's basically for cancer and tumors. And that was really interesting because it showed me a little bit more into what are the other fields. And the next one I researched was podiatry, and that's top right. That's basically feet and ankle. And then pediatrics is dealing with children. Shoulder is, as you can tell, shoulder. And then spine is dealing with the spine, and sports medicine deals with any sports-related injuries. And then hand and plastic. So the next research assessment I did was orthopedics and sports medicine. And so basically I got interested in sports medicine from doing the research on all the different specializations. So I looked more into sports medicine, and I learned about how it's both surgical and non-invasive. Non-invasive meaning non-surgical, like just casts and slings and things like that to recover. And then it focuses on athletic-related injuries, as you can tell. And to become one, it's a 1 to 10 year fellowship, which is a very long span of time, and that's after you already went through 8 more years of medical school. So that's a bit scary. And so next thing I did was getting into medical school, because this is such a major part of the whole process, and you have to get a doctorate degree to become a doctor. So some of the major points I learned from doing this was you have to have high grades, and that's extremely important going into it. And then make yourself stand out. So one of the interviews I did was with a doctor who actually was a volunteer firefighter throughout his college undergraduate, and he said that whenever he went to apply for medical school, that was one of the biggest factors that helped him get in, because he just stood out as being the one guy that was a firefighter in school. And the next thing I learned was interviewing is crucial, and how you go through so many interviews in the whole process of getting into medical school, so just practicing interviews is just a major part of that. And then the last one was apply to a lot and expect a lot of rejection. So basically, the more schools you apply to, the higher chances you'll get into one. So the next research assessment I did was why med students should study the business of medicine. And basically I learned that med students come out of school not knowing anything about business, and business is extremely important in medicine as much as it is in any other career. And basically business knowledge is crucial to being a doctor, because they deal with patients every day and deal with their accounts, and they have to deal with so many things that they wouldn't have been taught throughout medical school. And then also now with healthcare and reform, it's necessary to know a lot of business knowledge, because they don't know what's going to happen with all of the reform bills and stuff going on. And also it's just important for a doctor working in a private practice or in a group practice, they have to oversee and market their clinic, so knowing that vital business knowledge is good to that whole process. Okay, so the next research assessment I did was Obamacare's impact on doctors. And basically, it is not good for doctors at all, and it compromises the independence and integrity of medical professions. Basically, it's like a lot more government control and regulation over the medical field and medical industry, and basically it's just not a good thing for them because they don't have as much control over taking care of patients and doing what they need to do. Also, it has a flawed physician payment system, so like it just doesn't work. And one of the big things is it doesn't cover what patients need covered. So think of it like this: like a patient goes in with Obamacare and they need to just like consult with a doctor. So like the consultation will be covered with Obamacare, but then whenever they need to go back and get like an important surgery, Obamacare won't cover that. So the last like research assessment was over a UNT visit, and that is just when we went to UNT for a field trip in school. And for that we had to go see 2 classes, and 2 of the classes I sat in on were sociology of sport, and in that class they basically just talked about student athletes' troubles in school and how like being an athlete in school affects their grades in college like greatly, and like they don't have enough help. And it was just like really interesting because I got to see a different side of things. And then the second class I went to was Intro to Kinesiology, and basically it just was an overview of different careers in kinesiology. Even though like most of it wasn't something I would be interested in, it was still like interesting to see what else there is out there. So another big part of this year were the interviews we did, and so I did 5 interviews. And the first interview I did was with Dr. Shane Miller, and he works at Children's Medical Center in Plano, and he's pediatric sports medicine or an orthopedic doctor. Whenever I was speaking with him, I learned about sports medicine and to pursue the career that is for you. Basically, like whatever you're passionate in, follow that career no matter what it is, no matter what the pay is. And I also learned about how communication is key, and also what ties in with that is knowing Spanish in the South, because everyone knows Spanish and it's like a growing language, so knowing that is important to talk to patients. And basically just communication is key, because just by speaking with the patient you can find out what's wrong with them most of the time. And the next interview I did was with Dr. Robert Taylor, and he works at Stonebriar Foot and Ankle, and he's a podiatrist. So with talking with him, he basically said the same thing as the first interview: make sure it's what you want to do and you follow what you're passionate in, and also explain how listening is important and to make sure you have the right motivations. And that ties in with it, like don't be motivated by money, be motivated by what you're passionate about. The next interview I did was with Dr. John Crates, and he works at Plan Orthopedic Sports Medicine and Spine Center, and he is an orthopedic surgery and foot and ankle specialist. And it was interesting because he became interested in orthopedics the same way I did. He was played a lot of sports and got injured, and through that he found a mentor in like orthopedics and sports medicine and got interested in medicine through that. And he also explained how the path to becoming a doctor is challenging. Like as I showed in like the research assessments, basically to become a doctor it's a very long and hard process, and there's a lot of school, and you gotta have a lot of determination. So, and then the last thing he reiterated was communication and listening, like the other 2 interviews, and how important that is to the whole process of figuring out what's wrong with the patient. At the 4th interview I did was with Dr. Kendall Carl. He works at Texas Spine Consultants and is a spine specialist. Whenever I was meeting with him, he explained how business is important in medicine and how basically he uses it every day and how important it is to what he does. And also how you never clock out as a doctor. Basically, like you're always learning new things. There's always like changes in the medical field, and like you gotta like keep researching and keep learning, and you never stop. Like even when you're home, like you're on call, like there could be something that comes up. Also talks about how Obamacare is not efficient and does not work, like I outlined in the research assessment, and also explained how ignorance is bliss. And that basically applies the whole medical school thing, because like the less you know about the whole process and how much that goes into becoming a doctor, the less you'll be scared of actually going through it and following your passion. And the last interview I did was with Dr. Bruce Douthit. He works at Oasis Orthopedic and Sports Injury Specialist, and he's a sports medicine doctor. And he talks to me about how you should be confident but not cocky, basically like showing the patient that you know what you're doing and make sure that they're comfortable with you, and not be cocky, because like that could like make them not want to be with you, because like that just comes off as arrogant, and they would not like that. And so my mentor is Dr. Kendall Carl, and he did his undergraduate education at the Citadel College, attended the University of Florida for medical school, and did his residency at the University College of Medicine, and then did a fellowship at Baylor University Medical Center. He has been in practice for 12 years now. So why did I select him? I selected him because he seemed like he could teach me the most out of them, and it's like I felt comfortable with him, and I felt like I could learn a lot from shadowing him and just having him as my mentor throughout the year. And some of the highlights of his mentorship this year, like my favorite thing was going to see surgeries and getting to observe them. It's just like a really surreal experience, because you would never know how you would react to like standing right next to the operating table with someone's like just a body right there and watching it get cut open. Like it's just a really surreal experience that most people don't get to have in their life, and I really enjoyed getting to see multiple of those surgeries. So my original work. So for it, I created a general step-by-step guide to diagnosing a patient. And how did I do it was I just did a bunch of research, and also from observing my mentor and why he works. And I learned a lot about just being a doctor and what they do. And the real-world purpose is basically people who don't know much about medicine and being a doctor. Like they just look over this and see like a basic guide to doing that. And so this is the guide. And so like basically step one just outlines how before meeting the patient, just go over all their charts and information, and like anything could come up, like a prior condition or something that might be important to your diagnosis. Step two, depending on the problem, the next step would be to have a X-ray, CT scan, or MRI of the patient's affected area. And these should be gone over thoroughly by the radiologist and you to make sure like you see every little problem. And like this tells you a lot about the patient. Just by looking over these, you can see all the little details of like what's going on inside, and helps you come to the diagnosis. Next step is to speak with the patient, and like I said earlier, like communication is key, and so basically just speaking with the patient, you can get a lot about what's wrong with them and help diagnose them. And step four is to physically examine the patient's area of pain. And so when dealing with the spine, numbness or loss of strength in the legs usually tends to the lower back injuries, and then loss of strength in the arms and numbness leads to problems in the upper back and the neck. And step six is depending on if they have loss of strength and numbness, the next step is to check range of motion, and this is for both arms and legs. And so for legs, basically, you would have the patient like go up on their tippy toes and see if they can do that, then go back on their heels and just things like that to test their strength. And then by this point, a diagnosis should have been reached, and so now comes the treatment options, and basically it comes down to what the patient wants. Like there's so many different treatment options. Like there's creams you can just put on the back and it helps with pain. Like there's injections that you can do. But if you could suggest surgery, but if they don't want that, they don't want that. It's kind of, at the end of the day, you just outline different things they could do, and they decide. And so that was the original work. So for my final product, I did ACL injuries and their prevention. And I did this by doing a bunch of research and consulting with multiple different physicians to get the information. And the real-world application is different athletes in high school, middle school, of any age can just look over this and like do some exercises to help prevent ACL injuries and strengthen their body to prevent these like career-ending injuries from happening. So this is my final product. And so what is the ACL? Basically the ACL is a ligament in the center of the knee, and injuring the ACL. The ACL is most commonly injured in sports when there is a forced twisting motion on the knee, or when the knee is hit while your foot is planted. And when the ACL is torn, it does not heal, and like you have to do surgery to reconstruct it, and it's just a really not a fun process. Reconstructing the ACL. To reconstruct the ACL, they actually take grafts of other tendons and ligaments from your body, and they commonly take the patellar tendon and use that to like basically replace your ACL tendon in your leg, and like that's basically a picture of it happening. So recovery. Rehabilitation from the ACL injury is very complex, and it may take 4 to 9 months of rehab just to get back to original athletic activities. Initially, it might take a year or more for it to return to like how it normally felt before. And tearing of the ACL might not only end someone's career, but like it keeps them out from playing sports for a very long period of time. So you can see how devastating the injury is to athletes. And so am I at risk? So the highest risk sports for ACL injuries include basketball, soccer, volleyball, football, and rugby. Basically just doing anything that involves pivoting, jumping, cutting, or changing direction increases your risk. Increased risk if you have poor physical conditioning, like basically just if you don't do anything, you don't run, and you go outside and try to like do a lot of physical activity, then you're at a very heightened risk of tearing it. Also, just being a female increases your risk. And why is that? So basically, female athletes are up to 10 times more likely to sustain a knee ligament injury because than male athletes, because like just like not only their anatomy, but just like the way that they like land, and also like their lack of neuromuscular control over that part of their body just all like adds up and makes it like ACL injuries a lot more common for girls than guys. And so how can you prevent it? So there's some basic preventative measures, like basically appropriately warming up before athletic activity, working strength and conditioning with focus on thigh, leg, and knee, and using proper technique and equipment. And here's a bunch of exercises that you can do. And so it goes from like there's stretching exercises, next, and then strengthening exercises, plyometric exercises, and agility exercises, and like there's just a ton of different things that someone can do, and like basically like you do each different thing in like steps and do all the different exercises each like that number of times, and it helps build strength in that area of the body to prevent the injuries. Can I go to the video? And I have a video that helps show a lot of this.
Level and having a better job and living their dreams. I recently had an ACL injury, probably the most devastating injury I've had, and it was difficult. And having that injury kind of broke me down, and it made me have to start at zero again.
Females are 8 times more likely to sustain an ACL injury than males.
To help prevent these ACL injuries from happening, there are things you can do.
We're going to demonstrate today 7 exercises that you can perform to stay on the field. Exercise number 1, your basic squat. Allie's going to drop back like she's sitting in a chair. Knees do not come forward. Hips drop back. Head stays up. Drive up through the heels. And the first movement was not to bend at the knees, but actually drop the hips back, head and shoulders come forward, and she drives back up to the heels. Exercise number 2, jump squat. Knees, hips, foot stays aligned. She's going to generate upper body power. Load off. She's going to jump off, soft landing, drop back on the heels into a seated position. Exercise number 3, the lateral down. Same technique as a squat. Everything stays aligned. She's going to load up, drop to the hips. She's going to jump to the other side. Lateral hop there. Good deceleration on the landing. Very soft landing. Back over. You see the hip control, the challenge there. Keep a little pressure on the outside of the foot and through the heels. Everything is aligned perfectly. Single leg step up. Knee, hip, foot aligned. Going to drive up, opposite arm, opposite leg. As soon as the left foot touches, she's driving back up. Everything stays aligned. Opposite arm, opposite leg. Can also be performed on a bench, steps at home, or box. Double leg hamstring curl using the physio ball. Allie's going to bridge. Tighten the glutes, extend at the hip. Curl the ball in towards the body. Extend back out. And a good deceleration. The more advance the single leg hamstring curl. One leg is elevated, bridge, curling towards the body. Hip deceleration, a little bit of pressure on the outside of the hip. We'll keep the foot, knee, and hip aligned. Physio ball walkout. Alan's going to walk out with control, keeping her core tight, tummy tight, spine stays flat. She's drawing in. She's going to extend one hip. Down with control. Extend the opposite side. Down with control. And walk back with control. That's 1 rep. Should perform 5. Next exercise, single leg RDL, Roman deadlift. Al is using a 5-pound dumbbell. Drives back up to the hamstring, pauses, down for her next rep. You can use a soup can at home if you do not have dumbbells.
You do exercises in between and you can be quiet. It's very, very important. You can do that in the under and happen.
Back to the back. Okay, and so that concludes my final products. And so what has ISM done for me this year? Basically, ISM has given me a great real-world experience and has exposed me to a lot of things that most kids in high school don't get exposed to coming out and going to college. So it was a great experience overall, and just doing everything and getting the interview and making cold calls and just things like that were a great experience, and never forget it. I'd like to go ahead and thank my mentor for all the time that he spent with me this year and teaching me so much about being an orthopedic surgeon. And thank you all for listening. Any questions about anything at all? No? Cover everything? Yes.
What was your favorite part of the president?
My favorite part was the mentorship and getting to go shadow him and getting to go view the surgeries and all those things.
Which surgeries did you
They're all spine surgeries because my mentor was a spine surgeon, and I guess they're called lumbar 360. Basically, they would go in through the front and make an incision right there and put in some screws and stuff, and then sew them back up and flip them over and do the same thing through the back, but plating screws in.
see? Broken backs?
It's just a variety of things.
What was the hardest part?
The hardest part was all the work Coach Goff had us. There's a lot of work in it. You gotta
Like Physical 90s?
Yes, Jake. Okay, so basically the anatomical structure of the female body, and also they have less neuromuscular control over their legs and hips and things. So basically the way a guy would land if he jumped and stopped is very different than the way a girl would. And the way a girl lands just doesn't, it kind of stretches out their ligaments in the knees just not the right way. So it increases the chances of them tearing the ACL a lot, by a lot higher than males, 8 times as much.
Did you talk with your aunt? She had an ACL.
No, I did not.
Completely ripped.
I didn't know that. Anything else?
Keep doing
Box.
Yeah. You just not hit the pie box. Any other questions? Or guys good?
it. Very good.
Okay. Thank you.